welcome to another episode of Wine Wednesdays, where we whine and then refine our thinking. Today we're going to be whining about one of my favorite topics, which is how doctors don't know as much as you think they do. Cue the theme song. This wine, I'm going to be honest, I don't really know how to say this. Conte de la Terra. This is a Scout and Cellar wine from my girl Kim. I'm going to have her information below, so go check out her account for other reviews on wines or help with that. This is a red wine blend. Let's taste it together. This is one of the smoothest, light red wines I've had in a while. Very light, incredibly smooth, like I could drink this way too easily. I really liked it though. It's not like super bold and heavy, but it's not like super sweet either. It's a really nice in between. One of the things I love about Scout Cellar wines is they don't add any sugar. Nothing is added, no sulfites, nothing. So highly recommend, go check out Kim's page to find this exact wine. But yeah, okay, so let's get down to it. We're going to be honest, today is going to be a little bit more whining than it is refining. And sometimes we just do that, and that's okay. We've had a lot of refining recently, so this is going to be a nice whining session. And I'm going to be reading a lot of various stories about doctor experiences. So if you like cringeworthy stories about what people have experienced at various doctor's appointments and whatnot, then this episode is for you. I want to be able to whine a little bit and talk about that. I'm going to be honest, really the goal of this video is to put a little bit of distrust in doctors, if it's not already there, and to explain why. Also to empower you though, that you're not the only one that questions medical professionals. That's actually something a lot of people do and should be done, as we'll see in the stories. But also not just to be like, avoid all doctors, they're all terrible. No, to be able to also give you the tools and information necessary to help find a good doctor that's going to work for you, okay? So the caveat before we start this that I have to do, no, not all doctors are terrible. They're not all out to get you and your money and don't care about your health. There's wonderful doctors out there. They are just few and far between. Same with nurses. No, not all the nurses are terrible. I have many nurse friends and they are lovely, wonderful people. And they really do care about your health. I feel like nurses, more than anyone I run into, are like even more so like really for the patient and wanting to like work with you and for you. Characteristically, it's at least what I've found personally. But anyway, okay, so there's the caveat. No, this is not medical advice. None of this is, well, I just, Meredith said not ever go to a doctor. No, again, this is not just hate on all doctors in the medical system. It's done a lot of good. There's been a lot of wonderful things. There's also been a lot of change, and it's not what it used to be, okay? I have a whole nother video on this that talks about influence from Big Pharma on the medical world. It's another Wine Wednesday. Go check that one out and search for it. And I get into a lot more of like the funding of med school is 70% Big Pharma, just in case you didn't know. Things like that. So go watch that video if you haven't already. And again, the answer here is not never see a doctor ever. It's here's what to look for in a good doctor, and here's how to know if you have a good one, okay? All right, so let's get to the whining because I'm quite excited about this. It's just good. I put a poll on my page 2 different times to ask people, like, when did you start to question your doctor? And I got over 10 pages, 10 screenshots worth of answers from people. There's some good gems in here, guys. I'm gonna read about half of them, okay? Because there were just way too many. So let's get started. This is really fun, okay? So the prompt was, when did you start doubting your doctor or like questioning them? Slash, like researching for yourself, being your own doctor, advocating for yourself. What started their distrust in doctors? What are some of your stories? Okay, so here's what we got. I took my 18-month-olds to the doctor, and as I was talking, they were on an app searching symptoms. That's fun. Nothing like good confidence, and they know what they're doing and they're looking it up while talking to you. Also, they overdosed my baby. She is okay, but they denied any kind of vaccine reactions. I have a lot of stories on here about vaccine reactions, by the way. Also birth control. Those were the two most common ones on here by far. They kept giving me steroids for my eczema, but I was actually allergic to the steroids. This is fun. I'm an RN here pretty much ever since first working. Since my first year of working. The pediatrician told me breastfeeding would give my baby cavities, and it wasn't beneficial anymore after 12 months. Not true. They told me to put my 4-year-old in a booster and my very tiny 2-year-old front-facing. That's not recommended right now. My doctor asked me where I was getting my protein from as a vegan. Amateur. That's what she said. When I asked, why do I need this? Their answer is just, well, it's just recommended with no other reasoning or answer behind it. My doctor would prescribe me anything I asked for. Yeah, that's great. When they wanted to jab my 1-week gestation preemie with 6 shots, and then told us we don't love our child if we don't give them the jab that they were telling them to via CDC schedule. Okay. They prescribed antibiotics for my 6-month-old when she had a stomach virus. And his solution, doctor's solution to PCOS symptoms was to get on birth control and, quote, I guess try going gluten-free. Really fun. I love this one. I asked my PCP to test for the MTHFR gene disorder. His response, what's that? And didn't do it. Fun. Telling me that I better be giving my baby vitamin D drops because it's not transferred through the breast milk. That's false. It definitely is. My Lyme's disease went undiagnosed because results didn't meet the CDC guidelines. Fun. I went in with my 4th case of mastitis. 2 different docs dismissed me and wouldn't prescribe anything. I ended up in the ER having a surgery, removing almost 2 liters of fluid. My doctor said if I get a period every month, then there's no hormonal imbalance that you need to test for. As long as you're getting a period, you have no hormonal problems. Okay. No. My thyroid was within normal limits, quote, but was at the edge of the scale and I felt terrible. After my oncologist had me on a hormone shot for 9 months and they didn't even run labs. Yep. In order to refuse the vitamin K shot for the newborn, I had to talk to the head of the department. Fun. I was admitted for an infection and the doctor diagnosed me with diabetes. Plot twist, she had ordered a glucose drip, so she was the cause of the, quote, diabetes. That's a good one. Wow. The justification for fluoride pills for the 3-year-old was, have you seen pictures of kids who grow up without fluoride in their water? Their teeth look awful. Here's a good one. So she was on medication that wasn't working. She went to the doctor to get it changed. They prescribed the same medication, but it was just called by its generic name. And she didn't even catch that she was prescribing her the exact same thing, just under 2 different names. That's fun. I had an OBGYN tell me that there was no way that birth control pills would make you gain weight. Good. I said no to jabs while pregnant. I knew absolutely nothing. It just didn't feel right. The doc made me cry for saying no and was screaming, putting pamphlets in my face and told me that I needed to do more research. So I did and learned the opposite. Let's see. I asked if baby could wait to get their shots and the doctor just said no. Fun. I was 14 and they said I would need beta blockers for the rest of my life. Recently when I got blood tests, or my blood tested, and they were normal, but I still felt terrible. I feel like I get that one a lot too. It's like the joke, oh, your blood test came back normal, you're totally fine. That's great. When my daughter was sick and my diagnosis was right, but the condescending doctors wasn't, that's when I started to doubt them. My kiddo had pneumonia and was told to get antibiotics because it was bacterial, but they never even tested for bacteria. And my son was constipated, and the first recommendation was just to be put on Miralax for the rest of his life. That's really fun. Okay, and then a couple of my own personal stories just to throw out there. Okay, this is where it gets fun too, okay? All right, number 1. When I went to the doctor to, just when I first got pregnant, I was not on dairy at that point. And the doctor was concerned that I wasn't getting enough dairy. I told her I was on almond milk and that I drink almond milk regularly and stuff. And she was like, I'm just really concerned you're not gonna be getting enough calcium, which is vital to fetal development. And I was just like, you do realize that almond milk has almost twice as much calcium as cow's milk, right? And no, she did not know that. Then there was a friend of mine whose family member had cancer and went through chemo. And after going through chemo, the doctor then was kind of as like an afterthought was saying, hey, by the way, now that you've had chemo and you're more susceptible to cancer, you should probably like clean up your products. It's like, why are we not just doing that if that's something that someone should be doing because it can cause cancer? And why aren't we just doing that beforehand? I don't understand. Okay, and here's my personal favorite. My sister recently had a baby. I got to be in the room with her. It was wonderful. And this was a favorite of mine. This is a favorite story. She worked with a doctor who in a hospital delivered her first baby. Doctor had over 20 years of experience, and it was very clear that she had not often worked with people who refused to get any kind of a drug, an epidural during labor, because as my sister was up on the bed, like, you know, she was standing behind her, and she is checking for the baby, and I wasn't sure what she was doing at first, but I realized she's looking for the baby, and she's like acting all confused, and then realizes a couple seconds later, oh no, I'm actually in her butthole checking for the baby and not where I'm supposed to be looking. And I realized it was because she was just not used to women being up in that position, because when you're on an epidural, obviously you have no feeling in your legs and can't do that. So it was this super awkward moment of her trying to like cover up the fact that she's a doctor and should know that. And, you know, sorry, you know, just you had us all confused there. Like, oh, this is fun. This is really fun. Okay, so all that to say, there's our little whining sesh there of just how really more so frequent, honestly, stories like this are. So if you are one of these people that has a story that's made you question, I don't really know if my doctor is taking all of, you know, all this into consideration, or what they're prescribing me, I'm not really sure about, right? You are not alone, okay? Because as you can see from those stories, we got some problems, okay? Like I said, if you haven't, go watch my other video that talks a little bit more about what med school entails, but let me tell you right now, they get one nutrition class, okay? One nutrition class. And most of what doctors, just primary care physicians, learn in med school honestly revolves around just medications. The whole goal and the way that in the US at least, I know this is very different in other places, but in the US, doctors are financially motivated to keep people sick. And so are hospitals, and so are drug companies. They are motivated to keep people as lifelong users, okay? Doesn't work that way in other countries. And we continue to see various research come out. Just recently, literally like 2 weeks ago, we had a publication come out, The Serotonin Theory of Depression, a systematic umbrella review of the evidence, where literally they concluded, and I quote, "Our comprehensive review of the major strands of research on serotonin shows that there is no convincing evidence that depression is associated with or caused by lower serotonin concentrations or activity." Holistic doctors everywhere are going, duh, that's what we've been saying for literally ever. But what is the whole premise of SSRI drugs, which are, you know, like the antidepressants and stuff, which is your selective serotonin uptake inhibitors, those types of drugs, so anything for like, you know, depression, anxiety, mood, stuff like that. Their whole premise is operating under the fact that serotonin is exactly the opposite of what this review is now saying, right? That it's caused by low serotonin levels. So we see this happen time and time again. It's very concerning. It's very concerning, okay? I've seen enough just in my own family to really question, like, do the doctors really know what they're talking about? And the goal is really, at the end of the day, their goal is just to band-aid solutions, right? Their goal is, well, what's your symptom? When you're talking with the doctor, maybe you're familiar with this scene. Doctor, I'm having such and such problem. And they're like, well, what are your symptoms? Well, I'm having this pain. I'm having this, you know, issue. I'm getting migraines. All right, well, we've got this medication that could help with the migraines, and this pain that could help suppress, or medication that could suppress some of the pain you're experiencing in your back, or, you know, whatever. It's not, let's get to the root of this problem. It's just, well, I have some medications, or, you know, here's such and such that you could do to maybe make that pain stop that could be contributing to it. And that's about it, you know? When I went, I had a lot of acne that kind of started my health journey, and I have a whole nother video on that too. Go back and you can see my whole health journey of where I'm at now. And I went to a dermatologist and talked to them about what was causing my like adult acne, and the only thing they could tell me was, we don't really know, and here's some medications for it. And when I asked, do you think it could be food related? They were like, no, there's really nothing in the scientific evidence at the moment that concludes that it would be related to food. It ended up being a dairy allergy and a gluten allergy, and I just stopped eating those, and the acne cleared right up. So that's fun. Okay, so now on to the refining, now that we've had some nice whining time. It's good. Okay, refining. Here are a couple tips to look for when trying to find a doctor that is for your health, that's working for you. All right, here's my top things to look for. First off, you could find these things in a normal doctor. It doesn't have to be, I mean, it could just be like a normal doctor. Maybe you have found someone at a hospital that you love. It's wonderful. Good for you, okay? I personally think those are very few and far between. Typically, what I would recommend is looking for a functional medicine doctor or a naturopathic doctor, which, by the way, are not the same thing. They do function differently. So look into that, okay? A functional medicine doctor, naturopathic, holistic doctor, all these things, there are differences between them in their medical accreditations, if you will, the ability to prescribe certain drugs. Some of them do, some of them do not. So like I said, research that on your own. But I think that all of these things can be met, these criteria can be met with any of those doctors. It just really all depends on the doctor. Okay, so first of all, step number one for finding a good doctor that you know is actually going to be helping you and not hurting you, your health long term. Okay, number one, overall, you want them to be trying to find the root cause of your problems, not just system or symptom management. Okay, you want them to be talking about, let's try to find what's causing all of this, okay? Which would entail, number two, taking the time to look into your entire medical history. You want that first appointment to be like a good hour long or something, okay? You want to be able to feel like you can talk to the doctor. They're not just being rushed out of the room, that they're taking the time to really look into, when did that start? What kind of medication were you on then? What was your lifestyle then? Asking lots of questions. That is what you want, okay? Number three, they are probably going to want to test a lot of things, and that is good, okay? Because the whole thing with holistic medicine is it's just that, holistic, and you have to view it holistically in a sense of you have to be looking at a lot of different things, okay? So the fact that they're wanting to test things like hormone levels, nutrient levels, maybe gene testing, stuff like that is good. They're taking the time to really look at everything to see how it all comes together, because oftentimes with holistic medicine, it is really not ever one thing. It's the combination of so many things. It's lifestyle, it's your environment, it's, you know, things that you're eating, things that you're not eating, right? So many different things. You want them to emphasize and talk about and go to diet and nutrition first to heal the body. The first thing they should be asking you and talking about is, what is your nutrition like? What is your diet like? Because the biggest healer of pretty much all things is going to go back to your diet, and it's gonna, or at least just play a very large role in it, okay? So what was that, number 4? Make sure that they're talking about and emphasizing that. Also number 5, that they're emphasizing and actively working on your gut health. The gut health is so tied to so many things, from anxiety and mood swings to hormonal related things, like literally so many things. Your immunity, most of that is determined by your gut. So the fact that like doctors don't look at that more is honestly shocking. So make sure that whoever you're going to is actively working towards your gut. Okay, I don't even know what number we're on. 1, 2, 3, 4, 5, 6. We want them to understand the pre-steps before detoxification, okay? We want them to be talking about detoxing, but also about what needs to be done before detoxing things, okay? Which, just spoiler alert, is eliminating what it is that is causing, what is triggering different things, right? It's opening up the drainage pathways, very important. And you need to also be supporting the detox organs simultaneously while detoxing, or you're just gonna overload your body while trying to get rid of the things that are plaguing your body. It's quite a catch-22. So someone who understands that delicate balance and is taking that into consideration before just being like, here, detox all this stuff, okay? Important. All right, next. We want them to be taking into consideration and have an understanding for the environmental toxins like mold, the importance of the indoor air quality, scents and fragrances, and, you know, other things that are off-gassing in the house. Understanding all of that and taking that into consideration, very important. Also, we want them to understand the importance of what we're putting on our bodies, right? Various toxicants and whatever ingredients that are not safe for human health. We want them to have an understanding to some degree about that, right? And is going to be encouraging cleaning up various products that you use. Not just what we're eating, but also products you're using, okay? And also, lastly, just encouraging outside other, preventative care, maintenance care, like chiropractic care or acupuncture, red light therapy, different things like that. You want them to be on board for those things and understand the importance and benefit of practices like that in your everyday life. There are probably more, but those were the top ones that I could think of. So, yeah, okay, wow, really, how do these videos get so long? All right, well, this has been fun. Thank you for whining with us today. If you have another story or experience with doctors that you would like to share, definitely comment below because we'd all love to laugh about that. Hopefully this also helped you be able to kind of give you some tools to just find someone hopefully in your area that are going to be doing these things and a list of things to look for when you're doing consultations with doctors. You could also just try Googling like functional medicine doctor near me or whatever. There are various websites as well that you can go on to see certain certified ones in your area. All right. Stay sane, everybody.